Welcome to the deep dive. Today, we're jumping right into artificial intelligence and its pretty massive impact on health professions' education assessment, HPE assessment.
Yeah, that's huge.
So for you, whether you're maybe a learner, an educator, or honestly just curious, this deep dive is sort of a shortcut. We want to help you understand the complexity, maybe some dangers, but also the, immense potential here.
Absolutely. Our mission today is really exploring how we can harness this revolutionary power,
Yeah.
but without losing that crucial human touch, right? Or messing with the integrity of how we actually assess people.
It's a big challenge. We're basically unpacking a guide from leading experts, looking at how AI is, well, rewriting the rule book for assessment.
From personalized feedback right up to those high-stakes exams. And we absolutely have to get into the human response, the ethics. That's all critical right now.
Okay, let's unpack this AI assessment revolution because it really is here. For a lot of people, the big moment was the public release of generative AI.
Like ChatGPT 3.5. Back end of 2022, November 30th.
Right. And suddenly there was all this initial fear, wasn't there? Plagiarism, cheating, especially with written stuff.
Oh, completely. That almost drowned out the bigger shift that was really happening underneath.
Which is,
Well, the key thing, and folks are still kind of grappling with this, is that AI isn't just another tool you can, plug into how we already do assessment.
okay.
It's moving so fast, it's definitely here to stay, and it really demands we rethink our whole assessment philosophy from the ground up.
So adjusting methods, maybe scrapping some things altogether, introducing new ones.
Exactly. And this isn't a one-and-done thing.
Yeah.
It's constant evolution now.
So if AI demands this huge rethink, how have we as humans actually responded? I mean, it's easy to chuckle at things like the flirty ChatGPT voice,
Yeah.
but that tendency we have to sort of anthropomorphize AI, give it human qualities, that's a real challenge, isn't it?
It really is. Because we start treating these algorithms like they're conscious, like they have feelings, and they don't. They're tools. Powerful tools, but tools.
And that leads to misuse.
Yeah, either, way too much enthusiasm or deep-seated fear. Both extremes are problematic. Of course there are legitimate concerns.
Like learners maybe losing skills or faculty worried about their jobs.
Sure, those are real. But having open discussions and really grounding how we use AI in solid teaching theories, like TPAC or PICRAT, that helps.
Can you briefly explain those? TPAC and PICRAT.
Yeah, sure. So TPAC is about blending technological, pedagogical, and content knowledge effectively. PICRAT helps think about how students use tech passively, interactively, creatively, and the teacher's role. They basically ensure tech serves the learning goals.
Got it. So frameworks help manage the fear and keep focus on education itself.
Precisely. Now, where it gets really interesting is AI in action. Let's talk low stakes first. Personalized formative assessment.
Okay.
Here, AI can tailor things right to your specific needs, your pace, give you feedback almost instantly.
So like custom quizzes generated just for me.
Exactly. Or think about virtual patient simulations. Dartmouth's Patient Actor app is a great example. It really helps learners develop self-regulation, adaptability. It's quite powerful for practice.
Okay, that's low stakes. What about the big ones? High stakes, standardized tests.
Right. Summative assessment. AI can potentially help here, too. Think about consistency in clinical exams, like OSCEs.
Objective structured clinical examinations, where students go through different stations.
Yes. AI could, in theory, remove the variability between human raters, make it fairer. However,
Always a however with AI, it seems.
well, yeah, for really critical exams, like, say, the USMLE,
The big medical licensing exam in the U.S.
for those, human-in-the-loop oversight is non-negotiable right now. AI just isn't accurate or reliable enough yet to handle those judgments alone. We need that human safety net.
Okay, essential safety net. Now, sticking with rethinks, the classic take-home essay, AI seems to have completely upended that, hasn't it?
Oh, absolutely. The standard essay, where the goal is just producing text to show understanding, AI makes that, well, largely ineffective for checking real learning.
Because the point wasn't just the writing itself.
Exactly. It was about gauging understanding, synthesis, critical thinking, those higher-level skills.
So how do we adapt if the student isn't just the author anymore?
Well, the thinking is shifting towards seeing the learner more as a director.
A director? How so?
They might use various AI tools, text, yes, but maybe also video, audio, interactive elements to build a case, demonstrate their grasp of a complex problem. The written piece becomes just one part of a bigger picture.
A multimodal demonstration of understanding.
Yeah, more dynamic.
This brings us squarely to ethics, though. Our experts flag some major crossroads here. Bias, for one.
Huge issue. AI algorithms inherit biases from the data they're trained on that can creep into exam questions, assessment criteria, creating real inequities.
And learner data privacy.
Another big one, especially if data is used for training models without clear consent. Where does it go? Who owns it? Lots of questions.
And there was a strong warning about AI detection tools.
Yes, steer clear. The sources are really emphatic on this. They're just not accurate, not reliable.
And potentially biased themselves.
Correct. Often biased against non-native English writers, which is deeply problematic. The best approach, transparency.
So everyone just needs to be upfront.
Pretty much.
Yeah.
Learners and faculty should disclose when they used AI, how much, and what for. It builds trust, which is crucial as we navigate this.
Okay. So looking ahead, the pace isn't slowing down, is it?
Not at all. AI development is accelerating. It's going to keep impacting HPE assessment, probably in ways we can't even fully predict yet.
Which means faculty need support, development, training.
Absolutely critical. Educators need new skills. Things like prompt engineering, basically, learning how to talk to AI effectively to get useful results, and knowing how to weave AI into their teaching methods thoughtfully. It's a big learning curve.
It really is. So wrapping this up, what's the main takeaway for you listening? This deep dive shows AI and assessment is so much more than just the technology itself.
Definitely. It forces us to rethink teaching, understand our own human reactions, and grapple with some really complex ethical questions.
And maybe a final thought to leave you with.
Yeah, perhaps think about this. As these AI tools become completely commonplace, like calculators or spell checkers, how will you personally engage? Will you just live with the changes, or will you actively try to direct them?
To make sure HPE assessment stays relevant, effective,
Yeah,
actually prepares the next generation of healthcare professionals for this new world.
exactly. Because this journey, for all of us, is really just getting started.